healthcare. It is, of course, one of President Uhuru Kenyatta's big four agenda pillars. And let's take a look a bit deeper into where we really stand when it comes to universal healthcare in the country. Joining me once again is Gordon Odundo, healthcare and management expert. Thank you for making time for us today.
Thank you, Malika. Thank you.
All right, let's get into this with where do you see healthcare coverage in the country right now?
Healthcare coverage in the country is not where it should be optimally. And I think that's why the government has made it one of the big four pillars of the new agenda for the government. And indicators are that maybe 60% of the population don't have access to the healthcare that they should be at the moment. And the trials that the government is doing in the public sector with 4 counties is the first step in trying to make sure that that coverage is actually increased. More people can actually be able to access the health care that they deserve and that they need, and that's affordable and actually easily accessible to them.
Okay. What are some of the logistics that need to be in place for them to achieve this successfully?
I think the big thing that they really have to do to be able to achieve that is to follow on the successes of the CDF funds, which actually enhance public facilities in primary care level. The new county governments that now have been put into place at the next level by actually improving the services in the counties. And finally, I think we need to be able to support all that by having the right skills. I'm talking about from the lower level of kind of workers in the health sector, from lab technicians, farm techs, other professionals allied to medicine, doctors and nurses. They have to be able to be deployed. And not only that, I think we also have to increase training of specialist services in this country to be able to make that more successful.
Okay, and when we talk about some statistics, like you also mentioned, according to the KNBS in 2016, the top leading causes of death were pneumonia, followed by malaria, cancer, HIV, in that order. So disease patterns, however, in Kenya have rapidly transitioned, and we've seen an increase in non-communicable diseases. So the structure of healthcare, has it really been tweaked to take those things into consideration? And if not, how should they do that?
Kenya, like most other third world countries, are very different from developed countries. As you have rightfully said, we still have a huge burden of what you'd call infectious diseases. So our first challenge is actually to reduce the infectious diseases to manageable levels and actually eliminate them altogether, which there's a lot of success being achieved to attaining that. And that's why you can actually see there's a larger focus now on the NCDs, as they're called. But that can actually be attributed to improvement in the health sector, because now we can actually detect the disease very early as before. So people get alarmed, well, is cancer a new thing? It's always been there, but maybe we didn't have the right diagnostic tools to be able to test them. These now have to be supported by facilities. We have to be able to get the right diagnostic facilities in more places. We have to get the right interventions, whether it's surgical or through medicine, and also to do that, actually, we also need skilled personnel.
Another big issue, of course, cancer has been something that has been talked about widely. It's stolen away so many people over the past couple of years, and we've seen this issue growing. I mean, just a few months back, there were reports released that about 10,000 Kenyans annually go abroad for treatment. So that means clearly there's a lack in the current system, but especially cancer. It's one of those things that severely is something that is affecting the population, but is not given the priority it is required to be given in the healthcare system. So like I said, diagnosis is the first step, but what else needs to be paid attention to, especially when it comes to cancer in the country? I
think cancer and other chronic diseases, the biggest challenge I think in Kenya has been who pays for it, who actually pays. And I think the great initiative that has seen growth in the private sector has been the NHIF. Before that, maybe 3 years ago, without NHIF coming on board, a lot of people who had the diagnosis of cancer, or they had severe diabetes, or they had kidney failure, wouldn't really have facilities to go to. NHIF has been able to come up with packages that enable people to go to public sector, private sector facilities, and those facilities are now expanded their care. because somebody has actually been able to pay for that particular care. The only difference that you'll see is that people still have to go abroad, is that I don't think we have the facilities that can cope with the demand that there is presently. So the figure of 10,000, they would go there because most likely they want to go because they perceive the quality of care is better wherever they're going, or because they don't really want to wait for the care, which is available in Kenya in particular. And sometimes they perceive that we don't have the right personnel. But I think with all that we're doing, if we can continue expanding the universal healthcare coverage to cover all the NCDs, there shouldn't be any need for people to leave this country to go abroad.
Okay, that's very interesting that you say that. But even as we wrap up, each year the Global Wellness Summit identifies new trends that will have a meaningful impact on the wellness industry. And as far as Kenya goes, what trends can you point out?
I think I had the privilege of attending a wellness conference in September at the Kenyan coast. And this brought a lot of players in the world. What we're seeing is actually a convergence of health and wellness. When we talk about wellness, as countries get richer, like Kenya, people get richer, people aspire to live. They say we're going to live until 150 years. So to be able to do that, you've got to take care of your own health. And that means eating well, exercising, sleeping. And then the biggest thing in actually people traveling in other countries is actually cosmetology. Yes. People want their dental features to look better. They want to look slimmer. They want to look more beautiful, more handsome. So I think we're going to see that trend in Kenya, and I think you can already notice it, that part of the biggest industries growing next to entertainment is beauty and wellness and spa. And I think we need to grab it in Kenya, because prevention is better than cure anytime.
All right. Well, thank you so much for joining us.
Thank you for having me. It's been a pleasure.
All right. Well, we'll move forward from that conversation to one of our other stories for today, and that is the Standard Chartered Bank Kenya has announced a pre-tax profit of 9 billion shillings. Let's take a look at some of the details coming out of those results from the bank. We've got pre-tax profit of 9 billion shillings. Interest income actually declined by 6% to stand at 19.1 billion shillings. If we look at non-interest income, it's at about 7 billion shillings. But we'll move forward now to look at customers as well, customer numbers. Deposits actually grew to 225 billion shillings, and this is marginal actually compared to December 2018, where it was about 224 billion shillings. As for gross non-performing loans, they stand at 19.9 billion shillings. It's an 8% decline from the end of 2018. All right, so those were the results coming out of Standard Chartered Bank, and that's how we wrap it up on Business Today. Thank you for joining me, and of course you can stay with us right here on KTN News with Mbiuya KTN coming up next. My name is Malika Kazia. Have a lovely afternoon.